Right. In this session, we will discuss about deep fascia of neck. Deep fascia of neck we can also call as fascia colli or deep cervical fascia. Actually, deep cervical fascia will be divided into three layers. Investing layer of deep cervical fascia, pre-tracheal layer, pre-vertebral layer. We will discuss one by one. First we will discuss about investing layer of deep cervical fascia, then pre-tracheal layer and pre-vertebral layer. Before going to study about that, let me draw few landmarks. This is orbit and here zygomatic bone and here is the zygomatic arch. And here you can see the tubercle, articular tubercle or auricular tubercle, and here fossa, this fossa what we call mandibular fossa. Behind the mandibular fossa you can see one meatus. What is this meatus? External acoustic meatus, and here tympanic plate, right? Then this is the external occipital protuberance, and here you can see the mastoid process here. This is mastoid process. Then this is mandibular fossa, no? With the mandibular fossa, there will be articulation with the condyle of the mandible. So here is condyle of the mandible. Of course, mandible will be having the process here. What is this process? Coronoid process. So here is the coronoid process, and here is the ramus of the mandible. This is ramus of the mandible. This ramus of the mandible, in the lower part it forms the angle here. Then this angle will be continuous forward as base. Of course, here mandibular teeth. Here is the oblique line. Here you can see pterygoid plate and all. Those are not needed for this session. You can see one foramen here, mental foramen. Here you can see the temporal lines. This is superior temporal line. Here is inferior temporal line. If you see just below it, what you can find? Here is the hyoid bone, lesser corner of hyoid bone, and here is the greater corner of hyoid bone. Below that, what you can find? Thyroid cartilage. This is superior corner of thyroid cartilage, and here is the anterior border of one laminae, and here this is the inferior corner of thyroid cartilage. Below that, what will be present? You can see the cricoid cartilage. Below the cricoid cartilage, tracheal rings. Then below this, here is the sternum. This is the side view of sternum, and this is the manubrium sternum, and here is the body of sternum, right? And if you draw down Gifford process also you can draw. Manubrium sternum will be articulated with the one bone here. What is this bone? This is the clavicle. So here is clavicle. Clavicle lateral end articulated with which bone? This is articulated with, what is this bone? Acromion process. So here is acromion process. Acromion process will be continuous as spine or spinous process of scapula. So here is the spinous process of scapula. This is acromion process, and here is the spinous process of scapula, right? Then somewhere you can see here there will be spinous process of C7 also. Then if you see here, this is external occipital protuberance. Here crest will be there. This crest what we call external occipital crest. From the external occipital crest to the spinous process of 7th cervical vertebra, you can see one ligament here. What is this ligament called? Ligamentum nuchae. What is that ligament called? Ligamentum nuchae. These are the few landmarks. What is this? Manubrium sternum. What is this? Clavicle. What is this? Acromion process. What is this? Spinous process of scapula. Okay, I didn't draw total scapula, just I am drawing spinous process of scapula. From here to here, this is the neck, right? Let me draw the outline so that you will not confuse. Let me tell you what are the bony landmarks which I have drawn. Here I have drawn external occipital protuberance, and I will draw nuchal line also here. What is this line? Superior nuchal line, right? And what is this? External acoustic meatus. And what is this process? Mastoid process. What is this? Ramus of the mandible. What is this? Angle of the mandible. What is this? Base of the mandible. And here is the symphysis menti. Remember these landmarks. Next, if you see below, what is this? Manibrum sternum. What is this? Clavicle. What is this? Acromion process. What is this? Spinous process of scapula. And what is this? Spinous process of 7th cervical vertebra. And what is this ligament? Ligamentum nuchae. Right? So, these are the few bony landmarks which we need for the discussion of deep fascia. Right? First, we will discuss about the investing layer of deep fascia, and after that, we will discuss about pre-tracheal layer and pre-vertebral layer. Deep cervical fascia is covering the neck or encircling the neck like collar. Right? If you see from outside to inside, what layers you will come across? First, you will remove the skin. Once you remove the skin, you can see the superficial fascia. Within the superficial fascia, in the anterior part, you can see the platysma. Underneath the platysma, you can see the deep fascia. Right? The deep fascia is covering the neck structures like collar, and it also divides the neck into different compartments like visceral compartment, neurovascular compartment, and prevertebral compartment. First, if you take the investing layer of deep cervical fascia or general investing layer of deep cervical fascia, it has to attach somewhere superiorly, it has to attach somewhere inferiorly. Is it or not? If it is like a collar, somewhere it has to attach superiorly, somewhere it has to attach inferiorly, somewhere it has to attach anteriorly, somewhere it has to attach posteriorly. So, now we will see superiorly where it attach, inferiorly where it attach, anteriorly where it attach, posteriorly where it attached. Superiorly, it is attaching external occipital protuberance. We are coming from posterior to anterior side. First, it is attached external occipital protuberance. Then, what is this line? Superior nuchal line. Right? Then, what is this process? Mastoid process. Then, what is this? External acoustic meatus. But here, we are calling this one as cartilaginous part of external acoustic meatus. I have drawn skull, but in living individual, here cartilaginous part of external acoustic meatus will be present. So, cartilaginous part of external acoustic meatus. Then, it will be attaching to some part of zygomatic arch also. So, zygomatic arch. Then, angle of the mandible, base of the mandible, symphysis menti. Recollect. External occipital protuberance, superior nuchal line, mastoid process, external acoustic meatus. That means, cartilaginous part of external acoustic meatus. Then, zygomatic arch. Then, angle of the mandible, base of the mandible, symphysis menti. These are the superior attachments, right? Otherwise, these are the bony landmarks which are giving attachment to the investing layer of deep cervical fascia superiorly. Then, where it attached inferiorly? Inferiorly, what is this? Manibrum sternum, clavicle, then acromion process, spine of the scapula, right? Then, posteriorly, what is this ligament? It is extending from the external occipital crest and external occipital protuberance to the spine of C7. That means spinous process of 7th cervical vertebra. So, posteriorly, it is attaching and it is extending from external occipital protuberance and ligamentum nuchae, then spinous process of 7th cervical vertebra. These are the posterior attachment. Then anteriorly, where it attached? Anteriorly, it is attaching to the hyoid bone. Then it descends down and it fuses with the opposite side layer. See here, this side one layer will be there, this side another layer will be there. These two layers will be fused in the anterior part and that will be attaching to hyoid bone. When it reaches to upper part of the manibrum sternum, it will be divided into two layers, anterior layer and posterior layer, and it forms one space which is present above the suprasternal notch. This space what we call suprasternal space of Burns. What is the space? Suprasternal space of Burns. Is that clear? Now we have to take the cross section of the neck at the level of the thyroid gland. Then we have to trace horizontally and vertically. We will take the transverse section of neck at the level of the thyroid gland. Cervical vertebra. Here is the transverse process. Here also transverse process. And here is the lamina. Then here is the spinous process. Spinous process is bifid here. Right? And what is this foramen? Vertebral foramen. And here one more foramen will be present. Here also and here also. What are these? Foramen transversarium. If you see in the posterior part, here you can see one ligament. What is this ligament? What is this ligament here? Ligamentum nuchae. Here is ligamentum nuchae. Here you can see some muscles. What are these muscles? Trapezius muscle. So here is the trapezius muscle. Right? Of course, here you can see some other muscles also. Splenius capitis. And here semispinalis capitis. And here you can see the erector spinae muscle. Here scalenus anterior muscle. And here scalenus medius, scalenus posterior and levator scapulae. Scalenus anterior, scalenus medius, scalenus posterior, levator scapulae. Here also same structures. Scalenus anterior muscle, scalenus medius, scalenus posterior, levator scapulae. Then here prevertebral muscles. Then this side also same muscle will be present. No, what is this muscle? Trapezius muscle. No, trapezius muscle here, and here also you can see the trapezius muscle. Then any other structures are present in front? Yes, esophagus here. This is the esophagus. In front of esophagus, what you can see? You can see trachea actually. Here is the trachea. In front of the trachea, I told you we are taking the section at the level of thyroid gland. So we can see the thyroid gland here. This is thyroid gland. Behind the lobe of the thyroid gland, what structures you can see? You must be aware of it. You have to tell me what are the structures. Here is artery, internal carotid artery, and here is vein, internal jugular vein. Here also internal jugular vein, and here also you can see the internal carotid artery. Then in front you can see some muscles, some ribbon muscles. What are those ribbon muscles? This is sternothyroid and here omohyoid. Here also sternothyroid, omohyoid. Then here one more muscle is present. What is this? This is sternothyroid and this is what? Sternohyoid. This is sternohyoid. Then covering these muscles, there will be one more big muscle like trapezius muscle. What is that muscle? This is the sternocleidomastoid. So here also sternocleidomastoid. Then if you go still more outside, you can see platysma muscle here. Just I am drawing like a line. This is platysma muscle. Then still more outside, there will be superficial fascia. Superficial fascia will be covered by skin. So this is the total transverse section of neck at the level of thyroid gland. Now I have drawn only structures which are present in the neck. Now we can trace the investing layer of deep cervical fascia. After that we can trace the pre-tracheal layer and pre-vertebral layer, how they are arranged within the neck. First I will take the investing layer of deep cervical fascia. We are tracing from behind forwards, right? Actually posteriorly we know that it is attaching to the ligamentum nuchae. So here ligamentum nuchae. Then when it goes forwards and laterally, it is splitting and enclosing this muscle. What is this muscle? Trapezius muscle. So it splits into two layers and enclosing the trapezius muscle. like this it is enclosing. Then when it reaches to the anterior border of trapezius muscle, again it will be fused and forming the roof for the posterior triangle. See here, in between the sternocleidomastoid and trapezius only, posterior triangle will be there, no? So it forms a roof for the posterior triangle. Then when it reaches to the posterior border of sternocleidomastoid, again splits and encloses the sternocleidomastoid. This is one layer and this is another layer. It has split, no? Then when it reaches to the anterior border, again it will be fused and it will be fused with the opposite side layer. How it will be fused? We will see now. Here I am taking this side layer. When it reaches to posterior border of trapezius muscle, it has split and covering the muscle, and it has reached to the anterior border. Again these two layers are united and forming the roof for the posterior triangle. Then it reaches to the posterior border of sternocleidomastoid. Again it is splitting and covering the sternocleidomastoid muscle. Then when it goes forwards and reaching to the anterior border of sternocleidomastoid, again fused, and in the midline fuses with the opposite side layer. Is that clear? So this is only horizontal disposition, horizontal tracing of investing layer of deep cervical fascia. Very simple. From the ligamentum nuchae, it reaches to posterior border of trapezius muscle, splits and encloses the trapezius muscle. When it reaches to the anterior border, these two layers are united and forms a roof for the posterior triangle. Then at the posterior border of sternocleidomastoid, again it splits and encloses the sternocleidomastoid, and at the anterior border, again these two layers will be fused and in the midline fuses with the opposite side layer. Right? This is what horizontal disposition. Now we have to take the vertical disposition also. That means how vertically arranged. Right? Here vertically it will be arranged how? Superiorly all these structures are there. Inferiorly all these structures are there. It is stretching like this from superior attachment to the inferior attachment. Superiorly these are the attachments, inferiorly these are the attachments. From superior attachment to the inferior attachment it has been stretched. That means deep cervical fascia or investing layer of deep cervical fascia has been stretched like this. Right? But here some modifications are there. Are this fascia having some special features? Those special features we have to discuss here. At the sternum, at the base of the mandible, and in between the ramus of the mandible and the mastoid process. Here some modifications are there. What are those modifications? First, if you take the section at the base of the mandible, at the level of the base of the mandible, investing layer of deep cervical fascia is enclosing the submandibular gland, and in between the ramus of the mandible and the mastoid process, here parotid gland is there. So this investing layer of deep cervical fascia is enclosing the parotid gland. That sections we will see now. Now I am taking the section at this level, where at the base of the mandible. This is the section. So I am drawing the section of the mandible like this. This is the mandible. This upper part of the mandible, what we call alveolar process. This is the alveolar process. If it is alveolar process, teeth will be present, right? So here is the teeth. What is this fossa here? This fossa what we call submandibular fossa. Within the submandibular fossa, you can see the cut section of submandibular gland also. So this is the cut section of submandibular gland. If it is a cut section of submandibular gland, this surface of the gland what we call lateral surface, this surface of the gland what we call medial surface, this surface of the gland what we call inferior surface. Investing layer of deep cervical fascia, when it reaches below the submandibular gland, it will be divided into two layers. One is inner side, another is outside. That means superficial layer and deep layer. Superficial layer attaching to the base of the mandible. Deep layer is attaching to, here one line is there, no? Medial border of the submandibular fossa, what we call mylohyoid line. So here it is attaching to the mylohyoid line. That means investing layer of deep cervical fascia, when it reaches at this level, it splits into two layers. Outside layer will be attaching to the base of the mandible, inside layer attaching to the mylohyoid line. Is that clear? Then we will take one more section in between the ramus of the mandible and the mastoid process. To show that, I am taking the coronal section. See here, I am taking the section at this level. So here, anteriorly, you can see the cut section of the zygomatic arch. Here, external acoustic meatus, then tympanic plate. Here is the tympanic plate. Behind the tympanic plate, what process is present here? Styloid process. So here is the styloid process. Here, what gland is present? Parotid gland is present. So here is the parotid gland. When deep cervical fascia reaches just below the parotid gland, that means now it is reached to the just below the parotid gland, and it has been divided into superficial layer and deep layer. If you take the superficial layer, it is covering the outer surface or superficial surface of the parotid gland, and it is attaching to the zygomatic arch. Then deep layer, it is very loose and it is attaching to the tympanic plate. This deep layer, again it will be thickened and forms one more ligament. That ligament what we call stylomandibular ligament. This ligament what we call stylomandibular ligament. Is that clear? Okay. So here it is becoming two ligaments. How? This outside layer or superficial layer, it is thickening and forming the perotidomesenteric fascia. Why we call this as perotidomesenteric fascia? It is covering the parotid gland also, and it fused with the epimysium of masseter muscle. Here masseter muscle will be present, right? So it is covering the some part of the masseter also. That's what this fascia what we call perotidomesenteric fascia. And here this ligament what we call stylomandibular ligament. This is about the modification below the submandibular gland and parotid gland, right? Then if you see in the lower part also some modifications are there, or some changes are there in the attachments, right? What are those? See here, just above the suprasternal notch of the manubrium sternum, here this investing layer of deep cervical fascia has been split and attaching to anterior border and posterior border. That means superficial layer is attaching to anterior border, deep layer is attaching to posterior border. This space what we call suprasternal space or suprasternal space of Burns, B-U-R-N-S, suprasternal space of Burns, right? So this space, how it has been formed? Just above the suprasternal notch, this investing layer of deep cervical fascia splits into two layers. Anterior layer attaching to the anterior border of the suprasternal notch, posterior layer is attaching to the posterior border of the suprasternal notch. So in between these two, the space is there, no? This space what we call suprasternal space of Burns, right? So what are the contents of suprasternal space of Burns? Anterior jugular venous arch, okay? Then sternal head of sternocleidomastoid. Here sternocleidomastoid muscle is there, no? That is having two heads, sternal head and clavicular head. Sternal head taking origin from the sternum. So that part is present in the suprasternal space of Burns. First one is anterior jugular venous arch. Then sternal head of sternocleidomastoid. Then it is present in between the two clavicles, no? These two clavicles will be connected by ligaments. That ligaments what we call interclavicular ligaments. So what are these ligaments? These ligaments what we call interclavicular ligaments. Is that clear? Then we will find some lymph nodes also. That is about the suprasternal space of Burns, right? Then if you see the section at this level, at the clavicle level, at this level, if you take, there will be one more space. That space what we call supraclavicular space. What is that space called? Supraclavicular space. To show that space, I will draw here section of clavicle. So if you take the sagittal section of clavicle, here you can see the groove here. What is this groove? Groove for the subclavius. Within the groove for the subclavius, what is present? Here you can see the muscle called, what is this muscle? Subclavius muscle, right? Actually, we have already studied that in the upper limb. here is the subclavius, here is pectoralis minor, clavipectoral fascia covering the pectoralis minor. After that again it will be united, and when it reaches to the lower border of the subclavius muscle, again it splits and attaches here. That means anterior margin of the groove for the subclavius, posterior margin of the groove for the subclavius. Now we are least concerning about clavipectoral fascia. We are concerning about deep cervical fascia. Now deep cervical fascia is coming from above to attach, what is this? Clavicle. It is attaching to the clavicle, right? So just above the clavicle, here this deep cervical fascia or investing layer of deep cervical fascia has been split into two layers. Here is anterior layer, here is posterior layer, right? Otherwise, if you take, this is anterior layer, this is the posterior layer. In between these two layers, here this space is formed. This space what we call supraclavicular space. What is this space called? Supraclavicular space. According to the some authorities, the posterior layer will be enclosing the one muscle and forming the fascial sheath. What is this muscle? Inferior belly of omohyoid. But according to some other authorities, they will tell that it is not enclosed by this fascia, it is enclosed by upward extension of clavipectoral fascia, and it is enclosing the muscle. There is some controversy. Okay, some authorities they tell that investing layer of deep cervical fascia, when it reaches to the upper surface of the clavicle, it divides into two layers, anterior layer and posterior layer. Okay, anterior layer attaching to the anterior border, posterior layer attaching to the posterior border. This posterior layer will be enclosing the inferior belly of omohyoid and forms the omohyoid fascia. But some other authorities they tell that it is not forming the omohyoid fascia. This clavipectoral fascia or upward extension of posterior layer of clavipectoral fascia will be forming the omohyoid fascia. Anyway, we will remove this because we don't want to concern about clavipectoral fascia. We are discussing about investing layer of deep cervical fascia. That's what we will consider this one only. This space just above the clavicle, what we call supraclavicular space. Then what structures are present within the supraclavicular space? We can see the nerves. What are these nerves? Supraclavicular nerves. Before piercing the deep fascia, supraclavicular nerves are present within the supraclavicular space. One more structure is present here. What is this? External jugular vein. Where it open? Subclavian vein. So here is external jugular vein. Very simple. Supraclavicular nerves and external jugular vein is present. Clear? See, with this we have completed investing layer of deep cervical fascia. Right? Actually, this investing layer of deep cervical fascia having two features. What are the two features? We will see now. See here, this is investing layer of deep cervical fascia. It is covering it is enclosing the trapezius muscle and sternocleidomastoid. That means it is enclosing two muscles. Right? Then it is forming the roof for the posterior triangle and roof for the anterior triangle. See, this is the anterior triangle here. It is forming the roof for the anterior triangle. Here it is forming the roof for the posterior triangle. So it is forming the roof for the two triangles. Then here it is enclosing the two glands. See here, it is enclosing the submandibular gland and it is also enclosing the parotid gland. Then it forms two ligaments. See here, this is parotidomesenteric fascia and here is the stylomandibular ligament. So these are the two ligaments. Then it forms two spaces. See here, this is suprasternal space of bones. This space what we call suprasternal space of bones. And what is this space? Supraclavicular space. So suprasternal space and supraclavicular space will be formed by the investing layer of deep cervical fascia. So here also two spaces. Then it forms two fascial processes. Actually, from the investing layer of deep cervical fascia only, pre-tracheal and pre-vertebral layers are formed. So it is giving two fascial processes. Right? Those are pre-tracheal layer and pre-vertebral layer. Right? Then it forms two fascial slings. That means there will be intermediate tendon of digastric muscle, and there will be intermediate tendon of omohyoid. For these two intermediate tendons, sling will be there, no? That sling is formed by investing layer of deep cervical fascia, right? So these are the two features. Recollect once again. It covers two muscles, trapezius and sternocleidomastoid. It covers two glands, submandibular gland and parotid gland. It forms two spaces, suprasternal space, supraclavicular space. It forms two ligaments, stylomandibular ligament, perotidomesenteric fascia. It gives two facial processes, pre-tracheal layer and pre-vertebral layer. It gives facial slings for two muscles. What are those? Intermediate tendon of digastric muscle and intermediate tendon of omohyoid muscle. For these two tendons, facial sling will be formed by the investing layer of deep cervical fascia only. It is forming the roof for the posterior triangle and roof for the anterior triangle, right? So this is about the investing layer of deep cervical fascia. Then we will discuss about the pre-tracheal layer and pre-vertebral layer. Now we will discuss about the pre-tracheal layer. Actually, pre-tracheal layer will be arising from the under surface of the sternocleidomastoid. I already told you, investing layer of deep cervical fascia only giving facial process to the pre-tracheal layer. Now we are taking the horizontal disposition of pre-tracheal layer. This pre-tracheal layer taking origin, or it is extending from investing layer of deep cervical fascia underneath the sternocleidomastoid. Then it goes medially and it forms the anterior layer of carotid sheath. See here, it is forming the anterior layer of carotid sheath. After forming the anterior layer of carotid sheath, it is splitting into two layers and it is covering the thyroid gland. So how? See here, it is splitting like this and it is covering the thyroid gland. This is deep layer and this is superficial layer. If you see this side, it is taking origin or it is extending from the investing layer of deep cervical fascia underneath the sternocleidomastoid and it is forming the anterior layer of carotid sheath. After forming the anterior layer of carotid sheath, it is splitting into two layers and it is covering the thyroid gland. When it reaches to the midline, opposite side layer will be fused like this. Very simple, horizontal extension. It is emerging from the investing layer of deep cervical fascia underneath the sternocleidomastoid. It goes medially, forms the anterior layer of carotid sheath. Then it splits into two layers and encloses the thyroid gland and in the midline fuses with the opposite side layer. That's it. Here one worth mentioning point. In between this cricoid cartilage and the fascia which is covering the medial surface of the thyroid gland. Here there will be one thickening. This thickening what we call suspensory ligament of Berry. This is the suspensory ligament of Berry. That's what during deglutition thyroid gland also will move upwards. That is about the horizontal disposition of pre-tracheal layer. Recollect the horizontal disposition of pre-tracheal layer one more time. It has arisen from the investing layer of deep fascia underneath the sternocleidomastoid. Then it runs medially. It is forming the anterior wall of carotid sheath. Then it splits and encloses the thyroid gland and at the midline fuses with the opposite side layer. Then cricoid cartilage and the medial surface of the lobe of thyroid gland will be connected by thickening of pre-tracheal layer. This thickening of pre-tracheal layer what we call ligament of Berry, right? And one more thing you have to discuss here, the layer which is covering the posterior surface of the thyroid gland is very loose. Because of that, in case of enlarged thyroid gland, protrude backwards so that it will compress the trachea which leads to dyspnea and it compresses the esophagus which leads to dysphagia. Behind the ligament of Berry, you can find nerve here. This nerve what we call recurrent laryngeal nerve. If this recurrent laryngeal nerve is compressed because of the swelling of thyroid gland which leads to dysphonia. Why? Recurrent laryngeal nerve is supplying to all muscles of larynx except cricothyroid. So, if there is compression of this nerve, those muscles will be paralyzed which leads to dysphonia. So, If there is enlargement of thyroid gland, it pushes backwards and compresses the trachea, which leads to dyspnea, compresses the esophagus, which leads to dysphagia, compresses the recurrent laryngeal nerve, which leads to dysphonia. This is the horizontal disposition. Now if we take vertical disposition, vertically it is attaching to here. What is this bone? Hyoid bone. So it is attaching to the hyoid bone. Then it will be attaching to the oblique line of thyroid cartilage. So it is attaching to the thyroid cartilage. Then it encloses the gland. Which gland is present here? Thyroid gland is there. See, it has enclosed in the transverse disposition or transverse tracing also. In the vertical tracing also, it has to cover, no? So here, imagine this is the thyroid gland. This layer, after attaching to the hyoid bone, thyroid cartilage and also cricoid cartilage, it encloses the thyroid gland. After enclosing the thyroid gland, it descends down into the thoracic cage. So it extends down into the thoracic cage, and within the thoracic cage, pericardium is present, right? So imagine this is the pericardium, which is covering the heart. This is pericardium. After entering into the thoracic cage, it is attaching to pericardium. When it is entering into the thorax, at the thoracic inlet, it will be fuses with the Simpson's fascia or suprapleural membrane. This is only vertical disposition. Very simple. It is attaching to the hyoid bone, oblique line of thyroid cartilage, cricoid cartilage. Then it encircles or it encloses the thyroid gland. Then it enters into the superior mediastinum. Superior mediastinum means thoracic cage only. So it enters into superior mediastinum and it fuses with the apex of fibrous pericardium. Right? So this is the vertical disposition of pre-tracheal layer. With this we have completed pre-tracheal layer. Now we will discuss about the pre-vertebral layer. Pre-vertebral layer also taking origin or it is extending from the investing layer of deep fascia. So it comes like this and it forms the posterior wall of what? Carotid sheath. So anterior wall is formed by pre-tracheal layer, posterior wall is formed by or posterior layer is formed by pre-vertebral layer. So like this carotid sheath will be formed. After that it covers the pre-vertebral muscles. See here, these are the pre-vertebral muscles. It covers the pre-vertebral muscles and it covers the cervical vertebrae and in the midline fuses with the opposite side layer. That means it fuses with the similar layer of opposite side. See here, I am drawing this side. It is arising from or it is taking origin from the investing layer of deep cervical fascia underneath the sternocleidomastoid. Then it runs medially and it forms the posterior wall of the carotid sheath. So that here carotid sheath formation has been completed. After that it covers the prevertebral muscles and cervical vertebrae and fuses with the similar layer of opposite side. This prevertebral layer will give one fascial process. Fascial process means it gives one layer. This layer will be covering the paravertebral muscles. That means what? See here, this is scalenus anterior, this is scalenus medius, scalenus posterior, levator scapulae. These muscles will be covered by prevertebral layer and it goes backwards and disappears under the cover of trapezius. It is disappearing underneath the trapezius muscle. If you trace this side, it is giving the fascial process and it is covering the scalenus anterior, scalenus medius, scalenus posterior, levator scapulae. Then it disappears underneath the trapezius muscle. Then deep to the prevertebral layer, there will be cervical plexus and brachial plexus, right? And it gives one tubular extension. The tubular extension will be covering the brachial plexus and also subclavian artery, but it will not be covering the vein, because to allow the expansion of the vein, this fascial sheath or tubular fascial sheath will not be covering the vein, right? It is covering only artery and the brachial plexus. Is that clear? Of course, here spinal cord will be present, and this is the anterior horn, here is posterior horn. From here, that means from the spinal cord, spinal nerves will be coming out, no? So this is spinal nerve. The spinal nerve is emerging out like this side also. So these spinal nerves of C5, C6, C7, C8 and T1 will form the brachial plexus, no? That brachial plexus will be surrounded by sheath of prevertebral layer. That sheath what we call axillary sheath, right? That will be extending towards the apex of axilla, subclavian artery and axillary artery, along with brachial plexus surrounded by axillary sheath. This axillary sheath is derivative of prevertebral layer of deep cervical fascia. Then here within the carotid sheath what structure is present? Internal carotid artery, internal jugular vein, vagus nerve. Here also vagus nerve. Then here behind the carotid sheath you can see one more structure, that is sympathetic chain. So here sympathetic chain. Clear? Then in front of scalenus anterior muscle you can see one more nerve cut section, that is phrenic nerve. So this is the transverse section of neck along with tracing of deep cervical fascia. Right? Here we have seen transverse disposition or horizontal tracing. Then we have to discuss vertical disposition of prevertebral layer also. Right? For that I will take very small diagram. See here, this is the frontal bone. Frontal bone contains sinus, no? Air sinus. What is that air sinus? Frontal air sinus. Then here cribriform plate of ethmoid. Then here what is this bone? Sphenoid bone. What is this fossa? Pituitary fossa. This is what? This is the base of the skull. And here this is hard palate. And here is soft palate. Here cut section of mandible, and here teeth, and you can find the tongue here, epiglottis, and here cut section of hyoid bone, mylohyoid muscle. So we are least concerning about all these things. We are concerning about pharynx. See here, this is the pharynx. Pharynx will be having the muscles, no? What are the muscles? Superior constrictor muscle, and here is middle constrictor muscle, and here inferior constrictor. So this is superior constrictor, this is middle constrictor, and here is the inferior constrictor muscle. Below it will be continuous down as esophagus. So this is pharynx. Behind the pharynx what you can see here? Vertebra. This is the axis, here is the atlas, and here this is the cervical vertebra. If you see the vertical disposition, here is the attachment. So prevertebral layer superiorly it is attaching to the base of the skull. After taking attachment, it is divided into two layers. Here this is the anterior layer, okay, and here is the posterior layer. We must be aware of it. Anterior surface of the body of vertebrae will be having the anterior longitudinal ligament, right? So this posterior layer will be attaching to the anterior longitudinal ligament of cervical vertebrae and upper three thoracic vertebrae. So this is what? Posterior layer. Then here is the anterior layer. This anterior layer we can also call as alar fascia. This is alar fascia. Then there will be one more fascia which is surrounding the constrictor muscles. What is that fascia? That fascia what we call buccopharyngeal fascia. So here buccopharyngeal fascia. So anterior layer we can also call as alar fascia. That alar fascia fuses with the buccopharyngeal fascia. Alar fascia fuses with the buccopharyngeal fascia. Is it looking like human? See here, this is the lateral wall of nose, so that you can see superior concha, middle concha and inferior concha, and this is the nose here, and here is upper lip, and here lower lip. This is the sagittal section of head and neck. Clear? Very simple. Vertical disposition is very easy. Superiorly, it is attaching to the base of the skull and it divides into two layers. Anterior layer, what we call alar fascia, that will be fuses with the buccopharyngeal fascia. Buccopharyngeal fascia is nothing but this is the fascia which is covering the constrictor muscles of pharynx, right? Then the posterior layer descends down and fuses with the anterior longitudinal ligaments of all cervical vertebrae and upper three thoracic vertebrae. The space which is present in between the buccopharyngeal fascia and the prevertebral fascia, this space what we call retropharyngeal space. This space what we call retropharyngeal space. This retropharyngeal space, superiorly it is extending up to the base of the skull and inferiorly it will be open into the superior mediastinum. See here, it is opening into the superior mediastinum. What contents are present here? There will be loose areolar tissue. Because of this loose areolar tissue only, it is acting as a bursa. How? During deglutition, pharynx has to dilate. So, it will be dilated posteriorly because here retropharyngeal space is there. Then, if there is any inflammatory exudates or any fluids accumulated because of the infections, that will spread down into the superior mediastinum, or it may form swelling in the midline, that is what we call median swelling, right? Or it may spread laterally behind the carotid sheath. Actually, on either side of the space there will be carotid sheath. So, those exudates will be passing behind the carotid sheath, right? Other contents which are present in the retropharyngeal space are retropharyngeal group of lymph nodes, pharyngeal plexus of vessels and nerves. So, this is about the retropharyngeal space, right? And we have completed vertical disposition of prevertebral layer also. Clear? Then, next we have to discuss about carotid sheath. This is very important short notes question. What is carotid sheath? See, carotid sheath, it is a fascial sheath which is covering the carotid system and internal jugular vein along with vagus nerve, right? So, if you take the carotid sheath, see here, this is the carotid sheath. Anterior layer of carotid sheath is formed by what? Pre-tracheal layer. Posterior layer of carotid sheath is formed by pre-vertebral layer, right? And from where to where it is extending? It is extending from the base of the skull to the arch of aorta, because carotid system will be arising from the arch of aorta only. Of course, in case of right side, it is taking origin from the brachiocephalic. Still, brachiocephalic trunk will be taking origin from the arch of aorta only. So, this carotid sheath extending from the base of the skull to the arch of aorta, right? So, if you take, this is the sheath, this is the carotid sheath. Then, what are the contents which are present in it? In case of lower part, common carotid artery. After that, only internal carotid artery will be present. External carotid artery will be piercing the carotid sheath and it comes out. So, here is the external carotid artery. Then, internal carotid artery will be present within it. Along with this, any other structures are present? Yes, two important structures. Those are vein. Which vein is this? Internal jugular vein. In between the carotid system and the internal jugular venous system, there will be nerve. See here, I have drawn here posteriorly, and in between these two, there is vagus nerve. These are the contents of carotid sheath. Very simple. Carotid sheath, from where to where it is extending? It is extending from the base of the skull to the arch of aorta. Formation, anterior layer is formed by pre-tracheal layer, posterior layer is formed by pre-vertebral layer. Contents. Here, common carotid artery and internal carotid artery, internal jugular vein, vagus nerve, right? Along with that, still more you have to write. What are the structures which are piercing the carotid sheath? Actually, some structures are piercing the carotid sheath. One structure we know, external carotid artery has been pierced and came out. Then, tributaries of internal jugular vein. So, tributaries of internal jugular vein, they pierces the carotid sheath and opens into internal jugular vein, right? Then, branches of, what is this? vagus nerve, branches of vagus nerve. Ninth cranial nerve, glossopharyngeal nerve. Then 10th already is there. 11th cranial nerve, 12th cranial nerve. These structures also will pierce the carotid sheath, and it is related anteriorly with the ansa cervicalis, posteriorly with the sympathetic chain, right? So this is about the carotid sheath. Clear? Now we will discuss few applied aspects. Then and there only I told many applied aspects. I didn't tell applied aspect related to the peritodomesenteric fascia. See here, peritodomesenteric fascia very tightly attaches over the superficial surface of the parotid gland and also masseter muscle. Because of that, any swelling of the parotid gland which leads to severe pain because of the increased tension, right? In case of mumps and all, right, there will be severe pain because of increased tension. Then in case of cold abscess, how it will be formed? Caries of cervical vertebrae. That means in case of tuberculosis and all, there will be formation of pus in the vertebra. That pus may protrude forwards and forms a median swelling, or it may pass through the tubular extension. We know the tubular extension. What is the tubular extension? Axillary sheath. Through the axillary sheath, that pus or abscess pass through the axillary sheath. So these are the few applied aspects related to the deep cervical fascia, right?